Hello, my name is Lydia Lauder and I'm the National Director of Programs and Public Policy for the National Office of the Kidney Foundation. And thank you so much for joining Breakout Room 2, Family Planning with Kidney Disease. Before we begin, I'd like to review with you how to participate in this session. Please feel free to enter any questions you may have throughout the presentation. We will collect those questions and at the end of the presentation, we'll address as many as we can. You'll also have an opportunity during the question and answer period to ask questions live as time permits. We invite you to send any further questions to kidneyprograms@kidney.ca. Please remember that the Kidney Foundation is not able to offer medical advice. For specific information about your own situation, please speak with your healthcare team. And now it gives me great pleasure to introduce to you our moderator for this session, Dr. Leduc.
Well, thank you, Lydia, and welcome to our session on family planning when living with a kidney disease. First, let me introduce myself, and then I will ask to each speaker to introduce themselves. So I'm an OBGYN with a specialty in maternal fetal medicine, which means that I'm doing high-risk pregnancies. I'm working at St. Justine Hospital in Montreal. So for this session, each speaker will have 10 minutes after to speak about their own experience living with the kidney disease. So first, let me ask to Amanpreet maybe to introduce herself. Please do.
Hello everyone, my name is Amanpreet. I am 37 years old and I live in Brampton, Ontario. I was diagnosed with IgA nephropathy in the year 2014, and since 2016 I am a hemodialysis patient. So today I will be sharing about my experience of getting pregnant while on dialysis, followed by sudden miscarriage and its complications. I will also be sharing what I learned from it. Thank you.
Amanpreet. So, and then Shilpa.
Thanks. Hi, my name is Shilpa Raju. I'm 37 years old as well. I live in Toronto. My kidney disease is secondary to the medications for a lung transplant. So I received a double lung transplant 10 years ago and started on hemodialysis in 2021, so about actually almost exactly 2 years ago. And I've been doing home hemodialysis. And on the non-patient side, I work as a public health epidemiologist.
Okay, thank you. And Michelle?
Hi, everyone. I was diagnosed with an autoimmune disease in 2019, and then I did home hemodialysis for about 2.5 years. And then in December of 2021, I received a living donor transplant from a friend of mine. And I have just hit about a year and 2 months since my transplant, and it's going very well.
Wow, excellent. So, so now, as I said, each speaker will have 10 minutes to share with us, their experience living with the kidney disease. So we'll just start with Amanpreet.
Hello again. So as I mentioned, my name is Amanpreet, 37 years old, and I've been on hemodialysis since 2016. So my treatment was, I was on hemodialysis 3 times a week, 3.5 hours each day. In March 2021, I found out that I was 4 weeks pregnant. So my course of treatment was changed right away. My medicines were also changed, and I was prescribed medicines which are safe for pregnancy while on dialysis. My treatment days and hours were increased to 6 days a week, 6 hours per treatment. I was referred to specialists in Sunnybrook Hospital, Toronto, who have already handled multiple successful cases of pregnancy while on dialysis. Given the situation, it was recommended that nocturnal hemodialysis treatment at Sunnybrook Hospital will be the best option. So I started going to Sunnybrook Hospital every night for treatment. I was also closely monitored by the obstetrician with regular ultrasound and follow-ups. Everything seemed to be going fine. The nephrologist and the obstetrician were satisfied with the progress until I started with sudden abdominal cramps and heavy bleeding at home at 10 weeks. I went to ER but had miscarriage in the hospital. I was examined by the doctors in the ER. They tried removing the remaining tissue and I was sent home. The following morning, I spoke to obstetrician. She told me that the ER doctor suspects that I still have some part of the tissue and it will be best for me to get admitted in the hospital. I was twice induced with pains in an attempt to deliver the remainder tissue naturally, which failed. I then underwent DNC. DNC is dilation and cartilage, a procedure to remove tissue from inside the uterus. I came home after 3 days of hospitalization, but my bleeding kept on increasing. I was again admitted and came back home when the bleeding got better. But the antibiotic which I was prescribed gave me severe allergic reaction. I informed the doctor over phone and it was discontinued. After that, I started with severe abdomen pain and fever. I went to ER again and was diagnosed with a swollen colon. I was informed that the DNC procedure probably gave me infection. At this point, I had multiple doctors involved: nephrologist, gynecologist, obstetrician, and gastrologist. Later, I also suffered from uncontrollable high blood pressure for many months. After multiple complications and multiple hospitalizations, I eventually recovered slowly. Regular ultrasounds were done until the gastrologist and the gynecologist were sure that everything was back to normal. The whole experience has taught me many things, and that is what I mainly want to focus on today. It is advisable to start medicines which are safe for pregnancy on dialysis before you start trying for conception. In my case, during the time I discussed it with my doctor, the management changed the doctors and I ended up changing my medicines after I was 4 weeks pregnant. I have again discussed with my doctor that in future I will want to try again. So now I am already on medicines which are safe for pregnancy while on dialysis. Second, be aware and ready for the changes in treatment. Be mentally prepared to be attached to the machine for 6 hours every day. I traveled every night from Brampton to Toronto for nocturnal treatment at Sunnybrook Hospital. With such big changes in everyday life, it is extremely important to have a support system. My husband used to drive me to Toronto every night while I used to sleep at the hospital. My husband drove back to Brampton, slept hardly for 4 or 5 hours and came back to pick me up. Although I drive, but we just decided and prioritized to keep me comfortable as much as possible. Then he used to go to work, which is in Guelph. Again, it's an hour drive, then coming home in the evening and then driving me back to the hospital. So I could say it was getting really tough for him. I was also refraining from many household chores. Pregnancy while on dialysis is high risk, so we wanted to take as many precautions as possible. So please make sure you have more help available to you, have more manpower and help around the house. Getting timely and proper food is extremely important as well. We both don't have families here. It's just me and my husband. So we tried our best as we could, but I would highly recommend having more help available to you. Have a plan for it before you get pregnant. Next, if you are on in-clinic hemodialysis, talk to your doctor if home hemodialysis can be an option for you. I was suggested for home hemo when I got pregnant. However, I was already overwhelmed with the pregnancy news and was not comfortable and confident for getting trained and handling my own treatment. Now I am on home hemodialysis since February last year, and I can imagine how much difference it could have made if I was already on home hemo when I was pregnant. The training takes about 6 to 8 weeks. Now, if I get pregnant, I am fully confident to do my treatment by myself in the comfort of my home for 6 hours a day and 6 days a week. Please keep in mind, even if you're not on hemodialysis, please be aware of your treatment as much as you can be. In my case, I had hospital change for treatment and hospital admissions were done when no visitors were allowed because of COVID. I was my own spokesperson. I have always been very aware of my treatment, basic treatment settings, my medicines, dosage of medicines, allergies, transfusions. I can say that it helped me and the different medical teams to some extent. Finally, as a fellow patient, a female and a human, anybody who is planning or struggling for a family, I want to say, please don't be hard on yourself. One of my doctors said miscarriages are very common. 1 in 4 women go through it. Also, there are many normal, healthy women who have unexplained infertility. Yes, my pregnancy ended very abruptly and very badly. The evening I suffered miscarriage, the same morning my ultrasound came satisfactory with normal fetus size and heartbeat. I was too devastated and suffered extremely mentally and physically, but it could happen to anyone. We kidney and dialysis patients just end up blaming ourselves sometimes. One of the nurses told me of a dialysis patient who gave birth to twins full-time while on dialysis. It is the duty of the doctor to inform you of the condition and consequences considering your health. As a patient, we also need to understand all the aspects and not be in denial altogether. Have a plan and do all you can. When we were little, there was this quotation in school we were often reminded of, do your best and leave the rest. So that's exactly what we need to do in some situations. And it is important that we remind ourselves of it from time to time. Thank you so much.
Thank you very much, Henry. Now, Shilpa.
Thank you. So as I mentioned, I guess in my intro, I am actually a double lung transplant recipient. I received my transplant in October 2012. And so with the transplant, similar to with kidney transplant or any other solid organ transplant, there's a certain number of immunosuppression medications that you take to prevent rejection of the organ. And so for me, aside from the transplant itself, I had a very complicated recovery. I had PTLD as well within the first year, which is post-transplant lymphoproliferative disorder. And so that was another challenge. Basically, the first year post-transplant, I spent about 6 months out of the first year in hospital, 3 of those months in ICU. So the first year was really, really rough. And then, after that, things settled down and I got back into regular life. I was working, traveling. I met a person that is now my husband. And when we got engaged in 2017, we discussed kind of our hopes for a family and what we would kind of do about that, considering my health issues. And so we initially were seen in a high-risk pregnancy clinic. And at the time, the assessment of my health situation at that point was that my kidney function was still okay, but then there were risks associated with carrying a pregnancy just to the transplant because it was my lungs. So there's always a possibility I would end up back on oxygen or reject the organ. And all those risks aside, or if they're in consideration, my husband and I decided, well, we have other alternate routes, so maybe we'll explore that. And so we were referred to a fertility clinic through Mount Sinai Hospital. And through the course of that assessment, they did decide I was a good candidate for IVF. And so we were placed on a list to wait for the funded cycle. And so at this point, it's like spring 2017. And the timing we were kind of given was, it'll probably take about 2 years. The other consideration in my case was that because I'd had such a complicated recovery post-transplant and all these other issues in that first year, they were concerned about doing the egg extraction in a clinic setting and wanted it to be done in an operating room, which meant that it couldn't just be scheduled in line with my cycle. They had to actually, whenever that date of extraction would be assigned, it was going to be based on OR availability as well as the resources required to manage the OR. And so we just were like, okay, you know what, it's going to be a couple of years, which is fine. That sounds like a reasonable timeline. And a month before our wedding, so I got married in May 2018. In April 2018, clinic called and we were like, hey, what are you doing in May 2018? I was like, just getting married. And they're like, are you going anywhere? You have a honeymoon planned? And thankfully, we were actually not planning to go till September. So they're like, well, we have 3 dates. These are the dates that we have for the high risk patients. We've managed to book these OR dates. which one are you available for? And I took the latest, but even with that, essentially with in vitro fertilization, I should have expanded, in vitro fertilization, that essentially involves my eggs being extracted and being fertilized outside the body by my husband's sperm. And that we would then have these embryos created, and if they were viable, they would be preserved until someone else, a surrogate or a gestational carrier, could carry that pregnancy safely. And so anyway, we, all that to say, to do the egg extraction as well, there's a number of injections and hormones and things that need to be taken by the patient, as well as going in for blood work every couple of days, ultrasounds, all this to monitor, because you're essentially stimulating your ovaries to produce a bunch of eggs. Normally we release 1 per month, but in this scenario, they're trying to get out as many as they can and then try to fertilize as many of those as possible to get the highest rate of potential success down the road. So all of that was to get my cycle regulated. I started the medications in the weeks leading up to my wedding. Pretty much the day after the wedding, started the injections and the ultrasounds. It was exactly 2 weeks to the date. The egg extraction happened in an OR, and my husband did a sperm donation. And then they were also very conservative with the medication, again, given all of my health risks. So in the end, we ended up having a number of 6 eggs extracted, although there were a number more growing, and 2 of those fertilized. And then the other part of that is in Ontario, I believe, they will wait for the embryo to at least make it to the 5th day of embryo development to assess it for quality. And then those are the embryos that are preserved. And so at the time, I remember reading things that said, you know, like 1 in 5 fertilized embryos will, or fertilized eggs make it to that 5th day. So we were a little bit nervous with just 2, but we did have one that made it and was a good quality embryo. And so that's the one they preserved. And again, at the time, so this is now May 2018, and we were, you know, thinking we're going to give it a year. We just got married. We'll come back to this in about a year's time. And so February 2020, fast forward, we went on a vacation, and we got back, and the plan was to start looking for a surrogate as soon as we came back. But for most of the people here, I'm sure you'll also know what happened in March 2020. COVID hit, and kind of everything hit a pause, shut down. Myself also being a high risk patient, individual for contracting the illness, and also with the lung transplant being extra careful and all the immunosuppression, we were very, very cautious, like even leaving, going anywhere in that first year. So at that time, we're like, okay, we're just gonna have to wait a little bit till things settle down a little bit. And over the course of that year, I started to notice I was getting more short of breath, just day-to-day things. And we initially were like, must be the lack of physical activity, and also my lungs, like, you know, maybe they are starting to reject. This could just be like a natural process related to my lung transplant. And eventually, basically New Year's Day 2021, I ended up in the emerge because I couldn't walk a couple of steps without being very winded, which is really unusual for me at that point. And they couldn't figure it out right away because my oxygen saturation looked great, which if it had been a lung issue, that would have been a concern. But my blood pressure was extremely high, and that sort of tipped it off, and, you know, got a dose of a diuretic. And suddenly I was breathing better than I had been breathing for like a year. And at that point, they started to see, okay, I think like, it seems like you have extensive, through other tests and ultrasounds and stuff too, they discovered that I had pretty extensive kidney damage. And the plan then was to be seen outside of the hospital. And so another month passed by. Eventually, I was able to get into a clinic. And at the time, we still hadn't even realized how advanced the kidney disease was. And in the appointment, you know, the physician was like, well, it's already stage 4 kidney disease, but I hadn't been experiencing any symptoms really. So it was like, you know, that's good. Like now we're going to be controlling your blood pressure. So hopefully, maybe it's hard to say how long you'll be without symptoms, but that's a good thing. And at that point too, the thought was that, maybe a 20% chance based on my function then, 20% chance in the next 2 years, I might end up in dialysis or need a transplant. But actually the very same week, I started getting short of breath again. And this time it was actually a pneumonia. So that wasn't not related to the kidneys themselves per se. However, the medication to treat this specific pneumonia is pretty nephrotoxic. And where my lungs were at that point, my kidneys were at that point, it was just that little bit that tipped it over. And so 3 weeks in hospital treating the pneumonia, it became one of those like, well, we have to sacrifice the kidney to save the lungs. And so I ended up having a catheter put in hospital during that admission, and left on dialysis. But they were very strongly advocating for me to do home hemodialysis. And so over the course of the summer, I did train with the program at TGH, and then started doing it at home as of the fall 2021. And so then, 2022, again, we had a lot of challenges just with getting into the routine of things. And now we've just sort of hit this place where we're like, we really, really want to have a baby. I could carry, but there's so many more. It's way riskier now than it was 5 years ago for me with this whole dialysis situation. I'm also being worked up for kidney transplant. And so that's another thing that kind of, we were like, should we wait? And at this point, we're like, we're just gonna throw all our spaghetti at the wall and see what sticks. And so we've started looking for a gestational carrier. And our first thought, like from speaking to other people, not many that I know, but individuals who have gone through it. I know that one transplant person, at least from the lung community, had a fair bit of success looking like through her networks and having them share. And the agency approach she felt wasn't as personal. And from speaking to a couple of other people too, that's sort of been the impression I've got. So I think we've decided to start first for looking for a surrogate through our networks. And so a few weeks ago, we shared our story, and my friends and their friends and people have been sharing it with their people. And so now we're just in this stage where we wait. It's a lot of waiting between transplant and finding a carrier, but yeah, we're just gonna see how that goes. And thankfully, I mean, my home hemo schedule right now is nocturnal every other night for about 7 hours, and it works. It's been keeping me pretty stable. So yeah, it's just, I think for us, it's a lot of uncertainties, a lot of always feeling like you're waiting for somebody else to to do the things that you want to be able to do. And again, in my case, like knowing I could have gotten pregnant, but probably should not, for me anyway, with the lung transplant situation as well. So yeah, that's where we're at. And yeah, thank you for letting me share.
Well, thank you, Shilpa. So many fights, struggle, to deal with. Wow.
Yeah.
Wow. So Michelle, you're our next speaker.
Hi, everyone. Like I said, I was diagnosed in 2019. So in July of 2019, I was recently engaged, traveling, enjoying life. And I was a little bit tired and nauseous and just kind of chalked that up to stress. And it just wasn't going away. And so I went to my family doctor and told them all about how I was feeling and my symptoms, and they did some blood work. And I really wasn't thinking much of it, to be honest. And they called me the next day and said, go to the emergency room right now. And so I was admitted to Humber River Hospital with kidney failure. They really didn't have any reason to suspect the kidney failure. I was healthy. I had just got back from a vacation. So they kind of assumed that I was just dehydrated. You go on vacation, you see a lot of stuff, and you don't drink as much water as you should. So the first week I was there, they didn't know very much. And all that they could really say was that my kidneys were failing, and I was on high doses of prednisone just to kind of lower my immune system and see if it would fight back on its own. So a week into my stay at the hospital, I had just gotten my CVC line put in my chest for dialysis when I was officially diagnosed with Goodpasture syndrome. So I was transferred to Toronto General to have plasmapheresis, and I went on a chemo medication to also lower my immune system, along with the high doses of prednisone, and also an injection to stop me from ovulating at that time because the chemo medication was harmful to my body. So at this point, I was extremely emotional. There was so much that happened within a 2 to 3 week period. And I tried to break up with my fiance. I was so upset about the fact that there was just all of this emotion and all these things coming up, and that then you're talking about maybe you can't have kids later on. And I was 28 at the time and just felt like maybe I wasn't going to be enough. So obviously my husband did not take me up on that offer. And we even got married twice due to the pandemic. If anyone else got married during the pandemic, I'm sure you know the struggle. So by late 2019, I was doing home hemodialysis nocturnally. And our wedding was planned for May 2020. So the fact that our wedding was coming up, we decided to look into our situation and just see what was advised for us. I knew that people had gotten pregnant and had safe deliveries on nocturnal home hemodialysis. And I knew that I was hopefully going to get a transplant soon. So maybe that was an option as well. And there were a lot of options and not very many opinions. Everyone was just kind of saying, well, you could do this or you could do this. So I was referred to a high-risk doctor at Sunnybrook. And for my specific situation, I was advised to wait to try and get pregnant after transplant. I should say that at that time, it was only a few months. So there was still a risk of the Goodpastures having a flare-up. And I also had family and friends that had already applied to be donors. So the doctor and my husband and I kind of just decided that post-transplant would be better for me. We'd really work towards that transplant. And if it wasn't working out and the donors weren't working out, then we could reevaluate. But that was what we had decided at the time. Of course, we didn't realize that the pandemic would last so long and that my transplant would end up taking so much longer just because I was stable, and obviously there were much bigger things going on than my transplant. So I did receive my transplant in December of 2021. So I'm now a year and 3 months post-transplant, and I've been very stable, thankfully. And I have been given the okay to change my medications. And if there's no adverse reaction to that, then I can try to get pregnant. My husband and I went on our honeymoon in January to Aruba, and there is a small risk of Zika there. So we have been advised to wait at least 3 months from returning home from Aruba as well. So we took that into consideration. So right now we're just kind of waiting to see what happens with the medication and then if we're able to go forward. And with us, I think that Goodpasture syndrome is such a rare disease that we definitely still have some worries about if it's hereditary and if it could be passed along, but unfortunately or fortunately, I'm not sure, there just isn't enough data about it. There's not enough research. It's too rare. So we have decided that we would like to try and get pregnant. And it's just something that we'll have to keep an eye on. It's just so rare that we can't make a decision based solely on that. It's still a worry, but that is where we're at right now.
Well, thank you. Thank you very much. Yes, the good pasture syndrome, it's a very rare disease. Huh? So we don't have a lot of experience with pregnancy too now. So we were supposed to have a fourth speaker, Manuel, and he couldn't be here with us today, but he said that he will try to be at the time of the question, to be there, to answer the question. But essentially, Manuel is a man and who wanted to have a family while being transplanted. And he was supposed to discuss, to share with us, the conversation that he had with his partner and worries, and if kidney disease may be passed on. So essentially, he has a son now, so he was, willing to share with us, his experience, but he couldn't be here with us at this moment. But my understanding is that he will be here at the time of hopefully at the time of the question.
Sorry, Dr. Leduc, we also we have a video of Manuel.
Oh, you have one? And then
we do.
We can run. No, not right now. Can we run it, or
we
otherwise?
can. Yeah,
okay.
Absolutely.
And after that, at the end, I will take just the last few minutes, of the session, to have myself also a few slides for you. Okay, so go ahead with Manuel.
Hi, everyone. Just want to start off by thanking the Kidney Foundation for inviting me today, to my previous panelists for sharing their experience, and of course, all of you for taking some time out of your day to join us. My name is Manuel Escado, and I'm a 15-year kidney transplant recipient. I usually start off these conversations and presentations by saying I've been a patient my whole life. As a newborn, I was diagnosed with posterior urethral valves, PUV. So this meant that my childhood was filled with major surgeries, long stays in the hospital, many trips to specialists. Now, unknown to my family and I at the time was that this diagnosis of PUV would eventually lead to renal failure, which happened when I was 19. And I can go a little bit more into PUV during Q&A if you have any questions. Now, within 24 hours of receiving this diagnosis, I was on dialysis. And I would require dialysis for nearly 2 years until I received a transplant from a living donor, my mother, in 2007. Now, 2007, I consider a massive milestone in my life. Of course, I received the transplant. And I'd say there's probably only 2 other events that are just as important. One, the year I got married, which was 2014, and then the birth of my son, which happened last year, February 2022. So my son, Camilo, just turned 1, and it's been an absolute privilege having him. But as we've heard today, having children is complex, it's emotional, it's difficult. As with our kidney and transplant journey, navigating that system isn't always easy. It can be very difficult. And, reflecting on my experience, given my medical history, including the major surgeries to fix PUV, from a very young age, I was always worried whether I'd be able to have children. And to be clear, I always knew I wanted to have children, and there was nothing really to suggest that I wouldn't be able to have children. No flags were raised by my medical team, for example, at any point throughout my life. But there was always this lingering feeling that the different procedures I underwent, coupled with a lifetime of medication, would impact me. So for perspective, I'm 36, and of those 36 years, I've been on medication for, I'd say, probably 32 years. There's a brief gap there during my teen years. I think, late junior high, early high school, where I wasn't on medication, but otherwise, I've been on medication my whole life. I remember being a few years post-transplant, and I asked my nephrologist whether there was any concerns about being a transplant recipient and having kids. And his very quick, simple answer was no. There's no concerns for you having kids. And in preparing for this conversation today, I looked at some of the literature that's out there, and most, if not all, suggest that in fact is true. As a male transplant recipient, our rates and our ability to conceive children are along the same lines as the non-transplant community. But having said that, I had that lingering feeling, and navigating that fear wasn't always easy. And specifically when it comes to communicating with your partner. Very honest here, sharing this feeling with a partner, somebody you're dating, regardless of how long you've been together, it's not easy. And when I had this conversation with my partner, who of course would then turn out to would eventually become my wife, we were not at the stage where we were even thinking about having kids or having those conversations. I thought it was very important to be honest and share those feelings. I mean, this feeling was something that wouldn't go away, this worry that I had. And in my case, I struggled with how to communicate with my partner. If I recall correctly, I had this conversation about 2 years into our relationship. So if my math is right, I would say this was probably 5 years before we officially decided to have kids. So this conversation happened very, very early on. And then it was about 10 years before my son was born. But it was important. For me, it was important to have this conversation. One, because I want to be honest and open with my potential life partner. And two, I really felt, given my worries and anxiety on this, I really felt that she needed to know. One, so she was aware of what I was feeling, but two, also gave her an opportunity to think of what that could potentially mean to her if we weren't able to have kids. And kind of start the idea or start processing those thoughts and feelings. Now, given the lack of any medical evidence suggesting that we couldn't have kids, the conversation was quite non-eventful. We briefly talked about it, what it could mean down the road. For example, if we did end up having issues having a baby, then we would take the necessary steps to find solutions, whether this was through IVF, adoption, or some other mechanism. That was a very comforting relief to know that I had this and she was okay with it and was open to other routes of becoming parents. From the very beginning, she never showed any hesitation or concern about having children with me, just the fact that I was a transplant recipient or my earlier medical history. Throughout the years, she did have some questions, including trying to understand why my kidneys failed, whether PUD was genetic, and whether it could be passed down to any future babies. This was good. I really appreciated her willingness to learn, and it really challenged me to learn a little bit more about my medical history. Yet in other talks, I usually say I never wanted to be considered that kidney guy. And by that, I really mean that I didn't want kidney failure and transplant to define me. So by her asking these questions, it really drove me to take on that role, that kidney person role, kidney guy role, a little bit stronger, which now I've come to appreciate. That's one of the reasons why I'm here, sharing my experience with you all. So we made the decision to have a child in 2018, and that was a full 5 years before our son was born. After about 2 years of not being successful, which didn't really take me by surprise because I had those lingering thoughts and feelings, I spoke with my nephrologist, who then referred me to a urologist, who then referred us to an infertility clinic. In consultation with the clinic, we decided to pursue IVF. Now, we weren't provided a reason why we couldn't have children without IVF. Based on the results, everything appeared fine. And from the very beginning, the team at the infertility clinic was quite hopeful, encouraging that we would be successful given test results. Now, one of the first things that your transplant team asks you to do when you start considering having a child is to let them know, because there are concerns about your medication you take and what that impact may or may not have on your future child. So I spoke with my nephrologist and transplant nurse, and they advised me that with the medication I was on, they didn't have any concerns, so no adjustments were needed. This was a huge relief for me. I had been on that medication dosage for about 8 or 9 years already, and in fact, I'm still on that medication dosage. And as you know, kind of playing around, tinkering with some of those, with the meds may or may not have some impact on you. So I was very happy when they said that they didn't need to adjust those. In terms of having a baby, my primary concern was whether my medical history would impact our baby. Now, research on posterior urethral valve indicates that it's not genetic and it really happens by chance. But despite this, I raised concerns with everybody I talked to ensure that the proper steps were taken to assess Camilo throughout his development during pregnancy and after birth. I shared concerns with my nephrologist, the urologist, with the infertility clinic, our family doctor, our midwife, and each technician during the prenatal scanning, just to make sure that development was as it should be. I was very happy that throughout all this, everybody made a point to make sure that his bladder and kidney development was progressing normally and to check signs for possible PUV. And of course, everything came out with positive results. After he was born, our medical team kept an extra eye on his urine output just to make sure everything was good and working as it should be. But one of the things I really appreciated was that they recommended a kidney scan 1 week after he was born. He ended up having 2 more scans afterwards just because the first scan showed something that may or may not be something. But the due diligence that they took because of our concerns, because of my history, that's something I won't forget, because it really put us at ease knowing that they were doing all they could to make sure that everything was good and normal with them. So all this to say is that when you consider having children, please talk to your medical team and share any concerns that you may have throughout your pregnancy journey. These conversations aren't easy. Sometimes they might be awkward, difficult, etc. But it's so important that you share these concerns and have these discussions. In my case, my kidney issues, the transplant did not impact my ability to have children. But if you have concerns, speak up. A couple of things I've learned from being a patient for 36 years. One, we have an amazing healthcare professional team that will go above and beyond for your care. But 2, despite this, we still need to be our own advocates. You have to speak up. You have to ask questions. You have to share your concerns. Because honestly, if you don't, then who will? And as I noted, these may be difficult conversations, very awkward conversations to have, but they have to happen. And likewise, as I alluded to earlier, having communication with your partner is so important. Being open, honest during those difficult moments. And it's an up and down journey. I haven't gone through our IVF experience too much, but it is a very, very up and down journey. And you have to be there together as a team, because there's a lot of highs and there are very, very lows. It's interesting reflecting on, preparing for this presentation and just reflecting on my experience, and whether I was going to be able to get here or not. From a very young age, given my medical history, I was always self-conscious and probably lacked the confidence that I should have had. My medication and other reasons always made my weight fluctuate a little bit. I always looked younger than I was, and this was especially difficult during your junior high school, post-high school years, when you're in your early 20s, trying to get on the dating scene and whatnot. It can make things difficult. When I was on dialysis, I dropped to 112 pounds, and I looked more like a 15-year-old than the 18 to 21-year-old that I was. Post-transplant, I gained weight pretty quickly. As you know, we're on different sorts of medication that can have some impact. I remember during dialysis and soon after transplant, just not feeling confident or sure of myself. I didn't have the confidence to meet people. I directly or indirectly avoided the dating scene, because I always felt that I was that kidney guy, and that's all others would see me as. And I recognized that this was misplaced. And it was only once I embraced recognizing and acknowledging that the impact of my kidney health has had on me, and I have many people to thank for that, including my wife, the things in life just started to make sense. And again, happy to go through some of this during the Q&A. But in hindsight, the confidence issues I had were misplaced. I say this to others, so I'll say it today. We as the kidney and transplant community and patients, we're strong. We are strong, and we should be so proud of that. We go through so much that impacts us physically, emotionally, and mentally. And we've heard many of these stories in this session and through other sessions throughout the forum. And for me, this journey has made me a better person. I'm thankful where I am today. I recognize this, and I say this as a 15-year transplant recipient, and I may be in a different space than others who are in an earlier stage than their journey. But don't forget that, we go through so much, and we should be proud of what we do. Take them a couple minutes over my time, so I will end with saying this. Your kidney and transplant journey doesn't need to define you, but it is an important part of your life. So when you consider having children or when you have them, always ensure you keep an open dialogue with your loved ones and your medical team. They're there to support you. They're there to be your rocks, and only good can come out of having those conversations. And I look forward to the Q&A. Thanks all.
Well, thank you to all the speakers for having, share with us all the struggle that you have to do, the fights, all these steps that you went through. Before to end this session and to go to the period of question, I will just share with you, a few slides. It won't be long. It's a very general global overview of the chronic kidney disease. And in a woman, through the lifespan of a woman. So I'm sure that you're aware that, the chronic kidney disease, it's constitutes 3% of pregnant women in high-income countries. The prevalence of CKD in pregnancy is predicted to rise in the future due to two things: maternal age, because, women are, at the first pregnancy, women are getting older and older at the first pregnancy, and also with the increased incidence of diabetes. So you have, diabetic nephropathy. But why is it so important, and we have, as, Manuel said, to speak with your medical team if you plan a pregnancy, is just because a pregnancy by itself, there are a lot of renal changes that occur during a pregnancy. Just think about, the GFRs, that increase up to 50% during the pregnancy, and it starts as soon as in the first trimester, as soon as 8 to 9 weeks of gestation. The plasma blood flow increase up to 80% as compared to non-pregnant levels. And also there is changes at the level of the tubular function and how to handle water, electrolytes. Everything is altered, during the pregnancy, what you will see, we will observe a mild increase in proteinuria, glycosuria, lower serum osmolality, and reduction in serum sodium levels. So essentially, and I'm not talking about the cardiovascular changes also, because the plasma volume increases of 45% in pregnancy with increase in cardiac output. So these changes have to be handled by the heart and also by the kidney. It's known also that the outcomes, unfortunately, it's still possible to have a pregnancy, but still, adverse outcome can occur, when you have a chronic kidney disease. Just think about preeclampsia, fetal growth restriction, preterm delivery, C-section, or accelerated loss of maternal renal function. So all these things have to be discussed, of course, with your nephrologist and also with the obstetrician that will, take care of you during the pregnancy. Those are, we can ask ourselves, these condition or complication, they are not a contraindication to pregnancy. Okay, the main issue is to protect your renal function. So that's the main issue that has to be discussed, with your doctor. And of course, counseling pre-pregnancy is essential. So as Manuel said, you need to talk to your medical team. And sometimes also, depending on what is the cause of your kidney disease, if it's something from a genetic base, so you have to discuss, is there a chance that you can pass on your child, okay, the disease that you have. So this is something that, you have also to discuss well with the obstetrician and your nephrologist. So you understand that there is a multidisciplinary team that has to take care of you, the nephrologist, the obstetrician, or as I said, maybe earlier, when I presented myself, the maternal fetal medicine specialist, who I am, and also the genetic counseling, depending on the etiology of the kidney disease. So when you're an obstetrician and you have, a woman in face of you, she's not pregnant, she has a kidney problem, and you have to discuss, after a while about contraception, maybe at some point fertility, pre-pregnancy counseling, and optimization for pregnancy, such as medication. So you know that if when you have a renal transplant, you're on some specific medication. So we need to know if these medications are, compatible with pregnancy or not. If this is not the case, we have to prepare you, maybe months before for a potential pregnancy. And also, once you're pregnant, so we'll have to follow your renal function during pregnancy. It will depend also what is the severity of the renal insufficiency. Are you on dialysis, hemodialysis, or after a kidney transplant? We'll have to give you some preeclampsia prophylaxis to check your blood pressure, to be sure that the blood pressure is as normal as possible, thromboembolism prophylaxis, anemia, medication adjustment, bone health, peripartum care, and postnatal care. So talking about medication, we know that, oops, I'm sorry. Come on, okay, 1 second, yes. So there is some medication. I just made a short list, of medication that is possible, and compatible with pregnancy, and some are not. Essentially, when you're, so for the mycophenolate is essentially when you receive, a transplant, this kind of, immunosuppressor agent that we need to avoid in pregnancy because this is very teratogenic. All these, there is some guideline. We don't have specific official guideline, in Canada. This one is coming from the UK Consensus Group on Pregnancy and Renal Disease. It was published in 2019, and where, they cover everything, talking about, contraception, fertility, pregnancy care, medication it's possible to have or not, if you're on dialysis or if you got, a transplantation. So it's very complete consensus that they did, the UK Consensus Group. And finally, I just want to end this, as I said, this brief talk to say that, you're very good, to go through all these steps and to try to reach the top. And I'm used to say that, there is always a light at the end of the tunnel, and it's called hope. And you need to keep the hope that you have. It's very, myself, I learned a lot today just to listen to you, and I learned from the experience that you shared with us. So thank you very much.
Seeing there's no questions, Dr. Leduc, I've got a question for you, if we could start with that.
Yes.
If a person is considering becoming a parent and they have chronic kidney disease or are on dialysis or have a transplant, what would you say should be the first steps in following that hope and that dream?
Yes, okay. The first step is to discuss with the nephrologist to be sure that, according to the renal function, is it something, possible to think of pregnancy first. Second, are you fertile or not? Because sometimes, after, if you have an endpoint renal failure, most of the time you're not fertile. Okay, and if you are in this condition, I would suggest just wait after a renal transplant, because after that it will be much easier to handle the pregnancy. If you're on hemodialysis, as Amanpreet, from her experience, it's something difficult to have a pregnancy, but you need dialysis every day, and hopefully that is what you're going to have now, and it will be better hemodialysis as opposed to peritoneal dialysis. So and we don't have a lot of cases with hemodialysis in a pregnancy, because it's very tough, to handle everything, because during the pregnancy there is never something stable. It's always moving. So it's tough, to adjust everything, but, it's still possible. There is cases published in the literature, with pregnancy under hemodialysis. But first, you have to discuss with your nephrologist. That's the first thing. So if someone has a question with Manuel, or, for all other speakers.
I also have a question for the speakers this time, and just a general question, and it can be for any of the panelists really, is when you were embarking on the journey, did you speak to people other than your healthcare team? Did you speak to family and friends, and did you seek support or guidance from other people who were going through the same journey? And how difficult was it for you to find people going through that same journey?
I can start on that one. When I was first going through kind of figuring out if I wanted to try getting pregnant on hemodialysis or on or post-transplant, I think it was Shilpa that said that she is also at Toronto General. And the home hemodialysis team is very proud of all of the babies that patients have had there. It's a big thing. They're on the wall and everything. So they will talk to you about that if you have any questions or anything. And I also met with a patient who had 3 children while on home hemodialysis throughout the years. And I found that really reassuring, regardless of whether that was the path I was going to take or not. It was helpful to know that someone that was willing to even speak to me in the clinic had gone through that and could tell me the pros and cons and exactly what they went through. And just to speak to someone one-on-one, she was very open, and I personally found that really, really helpful, talking to someone who had that experience.
I can jump in next. So did we speak to anybody? No, we did not speak to anybody about this for a variety of reasons that I won't go too in depth on today, but we didn't speak to anybody. Primarily just we're more private people. We didn't want to get. So I know our family was very excited for us to have kids. Okay, they had been asking us for many years, when are you going to have kids? When are you going to have kids? I have 2 dogs. We have 2 dogs, and we would always joke, hey, like, we have kids. Like, what are you talking about? Those are our babies. But I know that amongst our very big family, there was a lot of not necessarily pressure to have kids. I never felt pressured, but there's always that, hey, when's it going to happen? And given, you know, given the pathway that we ended up going on, we were nervous that telling people about it was just going to be another layer to the journey. We didn't want to be asked consistently, okay, where are you guys at? How's it going? Like, where are you guys at in the stage? You know, we were already dealing with everything that comes with the IVF process, and we didn't want that added layer. I will say though, once it became official and once we were able to tell people the news that my wife is pregnant, we did start sharing those details. And we started sharing those details amongst our friends, our close friends. And I think something that like quickly became apparent is that, you know, going through IVF is very common, you know, and we try to hide it. We try to keep it amongst ourselves, but it's very common. So as we've told people our story, our experience, you know, they now come to us like for that guidance, kind of like what you were saying, Michelle, you know, that guidance, asking for input, asking, well, how did you navigate this? How did you do that? So in retrospect, I kind of wish that we would have spoken with people, because I think we would have got a lot of useful tips and tools along the way. There's no plans, at least at the moment, for another one. But if we do go down that path, I think we're just going to be open and honest and tell people where we're at. And it helps explain why perhaps we were a certain way at certain times in our lives. I mean, this happened throughout COVID, so we were able to hide it a little better in the sense that we were all in our homes. So it was a little easier to hide, but if we were to go down that road again, I don't think it would be. So we would be more open. And yeah, I'll pause there.
I can go next. I think for me, it was a little bit different just because this whole process started post-lung transplant before I had kidney disease. So at that time when we were talking, like even when we'd gone to the first sort of couple of appointments, just to even consider pregnancy, and the doctor was like, you know, there's like different levels of risk. It's kind of what you're comfortable with. And like I said, we made the decision we made at that time, just thinking about my lungs. And when we went through the extraction and all of that process, I did not talk to anyone. It was, like I said, during our wedding, it was in the days leading up to it and the days after. It was insane. Looking back, I was very well supported by my husband, but just all of the other pieces around it, we didn't really talk to anyone. However, when it came to actually thinking about, okay, what are the next steps? Like, how are we going to go about finding someone? That was really helpful, having seen a fellow lung transplant patient go through it. And in her case, she had cystic fibrosis. So there were like a whole other bunch of factors that she was considering. Whereas for me, the reason I needed the lung transplant in the first place was I'd had lymphoma in undergrad, and the chemo and radiation for that damaged my lungs. Now the medications for my lung transplant have damaged my kidneys. So it's kind of like there's always something I'm going to have to keep looking out for. But I guess there, at least not that I'm aware of, we haven't really considered any worries really around the genetic piece of that. More just like, okay, how do we find someone to carry this hopefully healthy embryo? And so with that, I'm going back to seeing someone else do it and speaking to her a little bit and seeing her process. She now has a baby and a toddler and has had their second baby is on the way through a surrogate as well. So it was good to see that process. And like Manuel, I realized, like, you know, when you share this, which we did a few weeks ago, we've had so many people either share or also refer us to like people who may have not gone through it the same way. So they may have gone through an agency, they may have done it a few years ago. The person may or may not be still like a thing, but it has really opened that conversation, and a lot of people are so willing to help in the ways that they know. So I think speaking about it probably, it worked for us at the time in terms of what we were looking for. But yeah, I do wonder if earlier, I don't think it would have changed anything process-wise, but it might have been, I don't know, good to have that support as well. But yeah, I mean, again, supportive partner makes a huge, huge, huge difference. And that really has carried us all the way through and will continue to carry us through this journey.
Someone else? Or because I have two questions in the Q&A. First one. So does the Kidney Foundation provide a support group for individuals that are in the stage of family planning?
I'd happily take that one, Dr. Leduc.
Yes.
So while we have several support groups available, and some of them are very targeted and very specific to certain interests or grouping certain people together, because this is still quite a, I don't want to say niche, but it's quite a small group of people and people do remain quite private. There is a one-on-one service available for people. So if they wish to get in touch, they can either fill out a form online at kidneyconnect.ca, or they can reach out to their local branch and they can get them in touch with a peer support volunteer who'd be willing to talk to them one-on-one and share their experiences.
Okay. And the second one is more common than a question. So I have a comment about being a parent. I had a baby, but she's now 19. So.
That is incredible.
Yes.
And great to hear.
Yeah, exactly, 19 years ago. So as I said, there is always a light at the end of the tunnel. Someone else that would like to make a comment about, what?
Sure, I can add another quick comment and really building off what Shilpa said about that supportive partner, which of course in my case, that was me. I mean, I shared a little bit of my journey a little earlier, but like, to be clear, this was like primarily on my wife, right? So going through the process, that is on her, like everything that comes with that and all the procedures and the medications and all that stuff. So really my role was to be there, to be that supporter, that champion, to do whatever it was that she needed, whenever she needed it. So we can go through the process. But to the earlier question about having some support or having some support system, again, like I think in retrospect, it really does just really reinforce that I kind of wish I would have had somebody, because the only person I had to talk to was my wife at the time. And I'm also trying to be, quote unquote, strong for her, because it's, as you heard earlier, it's quite the process. I'm going through IVF. So yeah, I guess just that's my point, that having somebody, somebody that you trust, somebody that you care for and love, that is there, it's not going to be too intrusive and knows how to give you space, I think would have been very beneficial. And then if anybody goes through this, just consider that. Consider reaching out to a person or two who you can count on, because it makes a difference.
Thank you, Manuel. Well, someone else said.
Yes, I'd like to share, in my case, my kidney disease was discovered after I got married. So my partner didn't have a choice in that case. So I came to Canada in 2010. It was the part of the immigration process to clear the medical. So I was perfectly fine. I cleared my medicals. So within 4 years, I don't know what happened. I was diagnosed with the IgA nephropathy and I had just 30% kidney function left. I got married in 2012, so just 2 years after the wedding, we got this news. But I've been very blessed. I have a very loving life partner, and he never even, not even 1% ever expressed that how are we going to have a family. So he just prioritized my health. During the first meeting, the doctor itself told that getting pregnant could be an issue. Even before dialysis, I was aware of it. But then in 2016, I eventually started with dialysis. And for the longest time, I did not think about pregnancy, neither did my husband, because somewhere it was embedded in my mind that I don't even if I will conceive. So I wasn't going down that path very strongly. I wasn't putting my intentions into it. But eventually when we tried, after in 2021. So I got pregnant pretty quickly, surprisingly. It hardly took me 2 months and I conceived naturally. But I never expressed this. I was aware that on dialysis, pregnancy and deliveries are possible. I was aware of it, but I never expressed it with my family or my friends or relatives because somewhere they just assumed, seeing my health condition, that it's just tough for her. And I never felt the need to prove or convince them that it is possible. So I just kept it to myself. And also I was aware that the pregnancy is going to be high risk itself. So there could always is a possibility for things to not go in an appropriate way or a favorable way. So I never wanted to discuss it. And that's what happened. I pretty quickly lost it. So in my case, my husband didn't know, but he's been really supportive. We might try again. It's just some personal reason we are delaying it for some time, but we might try again. And again, I wouldn't want to share it with many people, just my medical team for sure, and the closed ones.
Okay, thank you.
I just want to add on to that. We've been pretty open with our family about wanting to change our medications and things like that. But I will say that being post-transplant and being better, as some people think, that is a question that we get a lot from not close family, but family and friends is, oh, well, you had your transplant and you got married and you guys look great. Like, are you gonna have a baby? And they kind of just forget about the last 3 years of our lives. And it's one of those things that in order to bring awareness to it and to have people kind of not ask those questions, I've been really open and just said, like, well, you know, it's a process. Like, I have to change my medications. It would be high risk. And hopefully that kind of has people not asking those questions to other people because you don't know what they're going through. But it is one of those things that kidney failure and transplant are those kinds of invisible diseases, and people just ask these questions because you look better. So we have been fairly open with where we are in our journey and what's next for us.
That's so interesting. I found I feel like I had the opposite experience. I think people just assumed because of all the complications I'd had that probably it would be difficult. And so I feel like people were very respectful and not asking. However, once we did start looking for the surrogate and then like had explained, you know, here's all the reasons where it's maybe not the best idea for me to carry right now. I think it it was like explaining what was going on. And I think not that you have to do it for any other reason, but I think it gives people an opportunity to be there, which again, I'm a very private person. This has been a lot of sharing in the last couple of years. However, I think if it benefits other people, I think that's where I've seen, this has actually started conversations in many different places, not just related to the pregnancy piece, but even just organ donation and transplant. And sharing that journey has been also really essential, I guess, to getting people to talk about it and think about these things. And it's been interesting.
Thank you. So there is no more question in the chat. Hold on. Yes. See, it's from Christine Joet, was over 35, and she has a type 1 diabetes and a kidney transplant. She said, my husband was so supportive. We have our baby. Our baby is now 10 years old. After some miscarriage, we had a successful pregnancy and our girl was born. We wanted more children. My team was still good with me having a baby at 40. 2 years ago, after our little girl was born, I had a miscarriage and I didn't try again, but we had our amazing girl who is now 19. So we have the complete story of Christine, who has a girl of 19 years old. So from a type 1 diabetes. Is there something else? No, okay. No other comments to share or to say?
I'm actually going to ask a question which is a little bit on the other side of the spectrum, and it's more about contraception. If people have got kidney disease, if there's any special considerations that people would need to take as part of also that family planning process.
So I presume the question is addressed to me.
It is, yes.
So essentially, yeah, contraception, when it's time, to discuss about this, it's not everything, that a woman with a chronic kidney disease can take, because just because of the estrogen part in the birth control pill, for instance. So the main contraception is something with only progesterone. It can be a pill, an IUD, an implant, but only with progesterone as a contraception. Because if with the addition of estrogen, the risk of thromboembolism or thrombophlebitis, is just too much increase. It's dangerous, for the woman. So we will just recommend a contraception with that contains only progesterone. Or it can be an IUD with copper also, no hormones.
Okay, thank you so much. I'm not seeing any further questions in the chat box.
No, I don't. Me neither. So otherwise, do we stop, the session? But if this is the case, I would like really to thank you very much, all of you, for your, experience that you were, that you agreed to share with us. And when we learn, I'm sure, but I learned, so much. And well, don't lose hope, keep going, and thank you very much.
I'd like to reiterate that, and thank you also, Dr. Leduc, for being our moderator for this session. Seeing we're going to be finishing a little bit earlier, we welcome all our participants at the next networking session, and you can join that networking session from the main page. Thank you very much for joining us today. If you're bidding us adieu and going off to your evening, have a wonderful evening. If you're staying on, we look forward to welcoming you at the networking session. Thank you again, everybody.